How does birth method affect postpartum bleeding, Lochia? Imagine holding your newborn and wondering what to expect in the days ahead. One common part of postpartum recovery is Lochia, the bleeding that follows birth. It's your body's way of shedding the lining of the uterus and healing. But did you know that how you gave birth can change how much and how long you bleed? Let's explore how different birth methods influence postpartum bleeding. If you had a vaginal delivery, you might notice heavier bleeding at first. The blood is bright red and can include small clots. This initial flow, called Lochia rubra, usually lasts about 3 to 4 days. After that, the bleeding tends to lighten, changing from pink or brown to yellow or white. This process can take anywhere from 4 to 6 weeks, but some women might see it last up to 8 weeks. It's normal for the bleeding to come and go during this time. For women who have a cesarean section, or C-section, the bleeding is often less heavy. Since the surgeon cleans out the uterus during the operation, the initial flow might be lighter. The color and stages are similar, starting red, then pink or brown, and finally yellow or white. Because the uterus is more directly cleaned during surgery, some women notice their bleeding stops sooner, sometimes within 3 to 4 weeks. But this isn't the same for everyone, as healing and activity levels also play a role. Breastfeeding can also influence postpartum bleeding. When you breastfeed, your body releases a hormone called oxytocin. This hormone helps your uterus contract, which can make the bleeding lighten faster regardless of how you gave birth. So, breastfeeding might help your postpartum bleeding decrease more quickly. As a new mom, it's good to prepare for these differences. If you had a vaginal birth, you might want to stock up on thick pads for the first week or so. If you had a C-section, you may need fewer pads, but you should still be ready for some bleeding. Remember, it's normal for the bleeding to fluctuate, sometimes stopping and starting again. If your bleeding suddenly becomes much heavier, or if you pass large clots, or if you develop a fever or foul-smelling discharge, it's important to contact your healthcare provider. These could be signs of an infection or postpartum hemorrhage, which need prompt attention. Knowing how your birth method affects Lochia can help you feel more prepared and confident during your recovery. It's all part of healing and taking care of yourself as you welcome your new little one.